There are two statewide ballot measures that indirectly could impact the county service of health care. One's Prop 45, one's Prop 46. I'm just curious if you support, either one of you support either one of them. For the audience, Prop 45 would give the insurance commissioner greater authority on, authority he doesn't have right now on health insurance programs and whether or not he could reject those. Some members of Covered California oppose that, saying it will muck up their progress with Obamacare in California. Prop 46 would require drug testing of doctors, a database for prescription drug medicine statewide, as well as raise the microcap from $250,000 to about $1 million, and that's for pain and suffering in cases of medical malpractice. It's not down the middle of the plate for the board, but it does have an impact. Senator, do you support either one of those measures?
It's really not down the middle of the plate for the board. But let me tell you, in terms of Prop 45, I don't know if you remember when Prop 103 was on the ballot, so that the insurance commissioner, who was created by Prop 103, could say whether or not the rising premiums for your auto insurance could be justified. Essentially, it just said to the companies, can you just justify these crazy raises that you're giving everybody for their insurance premiums? Now, I don't know about you, but I feel the same way about the health insurance companies. I mean, they just raise premiums and raise premiums and raise premiums, and now with Covered California there, and frankly with the threat of Prop 45, they've only proposed a 4% raise to Covered California, which approved them all the way across the board. Now, I think that Covered California, the exchange, was a very, very good addition for our state. But I don't think they're really equipped to be the ones to say independently, I don't know where this premium raise is coming from. Because having approved every raise that was given to them for this year, I just wonder. So I'm in favor of Prop 45. Prop 46 is more difficult. If you're a child and a doctor commits error while they're operating on you, and you are in a wheelchair for the rest of your life, those things are called pain and suffering. You're not going to get any wages for any money for all that you lost in terms of what you might have done with your life, walking or running. You're not going to get any payment for that. What you will get is payment for your wheelchair for the rest of your life. So there's a certain amount of unfairness that goes on if all they pay is your medical expenses. On the other hand, the clinics are going to be so hard hit by these raises, possibly in malpractice insurance, which again brings us back to insurance companies that are raising these premiums, okay? It's not anybody else. It's just insurance companies saying to you, oh my God, we'll have to raise the premiums for these malpractice cases. So I haven't taken a position on it because I think both sides are right in this case. And they've put these two things together in a way that I think is extremely confusing. So I'd suggest that you just read it and make up your own mind whichever way you want to go.
Mayor?
I think 46 is the most interesting one, personally. There are three elements to it, not two, three. One is, should doctors be drug tested? Everybody, many other people are, athletes, many other people. Should doctors? Probably yes, right? Probably they should. The database for the advertising is very misleading. The database is only for the prescription of opiate drugs. Only opiates. No other drugs. So the idea that there's this vast database of your personal information, not true. Only opiate drugs. So if I'm a doctor and I prescribe an opiate drug, I have to check to make sure that this patient hasn't gotten 10 prescriptions for opiate drugs around town and is filling them at different drug places and going crazy, either selling it or going to kill themselves. Seems reasonable. Seems reasonable that that should be checked on by the physician prescribing the medication. Seems reasonable. As to the pain and suffering, the key question for the pain and suffering question is whether poor people should get a lawyer. And since I hope many of you know, my daddy started the Legal Services Corporation and believed very strongly that poor people should have access to lawyers. The pain and suffering number is the number that the lawyer gets to share if he wins or she wins. So since that number at $250,000 has been that $250,000 for 30 years, it has not been raised $1 in 30 years. Ask yourself whether, if you have your wrong leg amputated and you want to sue to get a proper recovery, will you be able to afford a lawyer? If you can't, do you think that 40% of $250,000 will be enough money to attract a good lawyer? No, right? So, for me, I favor some raise, whether the number is right that they have in there is open to discussion. The inflated rate at the rate of inflation is, I think, 1.1 million is the equivalent of $250,000 30 years ago. So it's quite true that it will cost clinics. It's also quite true that it will cost the county, by the way, because the county will have to pay higher insurance rates. So that's a significant matter. But I'm torn, as I think probably we both are,
Right, we discussed
in
this.
thinking about, gee whiz, should people be able to get lawyers to take these cases? Because right now, lawyers will not take those cases.
Let me, we're going to have time for one more question.
for that one.
About Covered California, should it embrace coverage of undocumented immigrants, Mayor? The healthcare system in California?
It's the cheapest possible result. The idea that, oh my God, they'll all come here to get all this health care, it's just not true. They're here, and if they go to the emergency room, they cost $3,000 or $4,000 a day if they're hospitalized. So what is our goal as a community? Our goal is to keep people out of the emergency room and not, particularly in the public health arena, to not have people with contagious or other kinds of illnesses circulating around untreated, to not have people coming into emergency rooms and costing a fortune. So I'm for it. I think it's a good idea. The board passed it 2 weeks ago. I was at the meeting. I think it's a good idea. I think you got to be very careful on the money here. I think you have to study healthcare costs, and Sheila is an expert here. It's just much more expensive to treat people in emergency rooms than it is to treat them with prophylactic care in the community. The biggest challenge to it, however, unfortunately, is even more than money, is the availability of doctors. This is a really serious problem, and it's going to get worse, not better. So we have to manage that delivery system very, very carefully to make sure that the rates are high enough to allow doctors to be able to work in those practices and that people get adequate prophylactic care.
Senator?
Well, the question, the way you put it, Conan, was kind of interesting because you said, should Covered California be covering people like undocumented immigrants? And of course, you know, Covered California is handling a federal program, and the Fed said we can't cover those people. So what happened is, I mean, I know you know, and I'm not saying that you made any mistake here, because no, but you.
No, I asked the wrong
but
question.
Your answer.
Blame it on me.
Conan for president.
Actually,
It's exactly right,
was
and this
just
was
reading.
not a critique of Mr. Shriver's answer at all. Seriously, because what he said is correct. Because what the state has to do, because the feds will not allow us to use that money, is the state has to put in extra money to cover people who are undocumented and other people who are not insurable under the Affordable Care Act, which many people call Obamacare. And so the state then says to the county, okay, here's some money. You add to it, and you cover those people if you want to. And the county, to its credit, has decided that we need to do that. Why is it to its credit? Because we don't want people running around sick because we said, you know what, you're no good, so we don't want you to have a doctor. I'm going to have a doctor, but my kids are all in school together with everybody. So I think it's important for us to be able to take advantage of what the state allows us to fund for undocumented people. And they're not the only ones that are not able to get insurance under the Affordable Care Act. There are several other categories. So I applaud the supervisors for having decided to augment our medical program with that state money and some of our own to try and cover everybody. It's important, I think, for all of our health.
thanks for bailing me out on that answer. We will summarize the candidacy of both of you. Mayor, start us off. You got 2 minutes. Again, your priorities as the member of the Board of Supervisors from the 3rd District.
Okay, so the general question.
Yeah,
in
general question, and we'll wrap it up. on that.
Closing?
Is this a closing or
I'm
this?
sorry,
it's
it's a
whatever.
closing. There, I did it again. A closing.
Okay. Well, my number one priority is to get the transportation system built as fast as possible and as well for the valley as possible. I don't just say that because I'm here. I really believe it will lead to a tremendous job growth elsewhere. My second priority is job growth. We can't have the social services that we're discussing if we don't create jobs. We've lost 200,000 jobs. We've lost film and television jobs. the state of New York has taken all of the 1-hour shows to New York. And these credits, it's important to remember, apply to the below-the-line workers, not the wealthy movie stars. It's the people who live, your neighbors, build sets, paint them, electricians. Those jobs, we have to fight to keep them here. That's super, super important to me. I think I've had experience in producing that kind of growth. I've worked with private sector investors. I think I can cause some of that kind of stuff to happen here. I think the third thing for the Valley, we haven't even discussed, is water policy. There isn't a county water plan. There's a tremendously large aquifer in the valley, as I'm sure many of you know, that if the water were cleaned, could produce a significant share of the water consumed out here. That's a long-range plan. It needs to work with the Department of Water and Power, other agencies. It's a complicated thing. But the idea that there is no water plan, might be a reason to secede from the county and or from the city. You want a water plan out here. Your kids want a water plan. I want to work on that plan. We did I'm sorry to keep repeating Santa Monica, but we do right now serve 75% of the water in Santa Monica is served from wells under San Vicente, treated in a treatment plant that the city built and served as drinking water. That can happen here. We're spending tremendous carbon to pump water down here. It's not a sustainable thing for your kids' future or our future. We need to fix that. So one of the two of us is going to be back here in 4 years asking to be reelected. And when I come back, if it's me, I hope that those 3 things, everybody will raise your hand and go, well, you did some things wrong, but you did deliver on those 3 things. Thank you for having me. Good night.